Have you ever opened a medical bill and felt the knot in your stomach and thought, I don't even know what I'm looking at? I'll just pay it to get it over with. You're not alone. And that's exactly what billing departments count on. But once you know what you're looking for, you can catch errors, ask better questions, and save hundreds or even thousands of dollars. Most people treat medical bills like bad news. They see the total and panic and pay it just to make it go away. But here's what many people don't realize. Billing mistakes are common. From duplicate charges to incorrect codes, errors can slip in and they can cost you hundreds or even thousands if you don't catch them. In this module, I'll show you exactly how to read your bill line by line, spot common mistakes, and challenge them right away, politely, confidently, and effectively. The agenda for this module, we will wait for 2 documents, not one. Request an itemized bill, what to look for on a bill, how to call and dispute charges, keep records for every call. Example, the $1,500 turnaround. Quick red flags that deserve a second look. Pro tip roundup and closing and next step. Have you ever gotten a bill and paid it only to find out later your insurance hadn't processed it yet? That's one of the most common ways people overpay. Let's start by making sure we have both documents you need before paying anything. Wait for 2 documents, not one. Before paying a penny, make sure you have 2 documents, not just one. The first, the explanation of benefits, the EOB, from your health plan. It's not a bill. It shows what service was billed, what the plan allowed/paid, what amount the provider may bill you. 2, the provider bill from the hospital, the clinic, the doctor. It's the statement of charges and what your insurer has or hasn't applied yet. These 2 should fit together. The amount you owe should match. Now here's an example. You get an EOB that says you owe $85. Then your provider bills $220. That mismatch is a clue. Maybe insurance funds haven't posted yet or a code needs correction. Now here's a pro tip. Wait until you receive both documents before paying. Some offices send early statements before insurance finish processing. Patience protects your wallet. Always compare the EOB and the provider bill first. Have you received a one-line bill that just says total due $2,000 with no details? That's like getting a restaurant tab that doesn't list what you ordered. You have the right to see what you're paying for. Request an itemized bill. Once both documents arrive, don't pay a statement that only shows a total. Ask for the details, an itemized bill. Call billing and say, please send an itemized bill listing each of the charges and codes. Your itemized bill should include each service, supply, description, the CPT, HCPCS code, what was done, the charge for each line, any adjustments or payments already applied. Why this matters. A summary can hide errors. An itemized bill exposes duplicates, wrong items, or mismatched service. Now here's an example. Sarah's summary said $2,800 after insurance. The itemized bills show a $350 drug she never received. One call got it removed. Pro tip, ask for an itemized bill by a secure email, a portal message, or mail. Some portals don't display full coding details. Once you got the itemized bill, how do you know what's wrong? Think of yourself as a detective. You're looking for clues that don't fit. What to look for on a bill. Now play detective. Check for these below. Duplicate charges, same test or supply listed twice. Upcoding, a higher complexity visit than you actually had. Canceled services, orders never performed but still billed. Facility or room fees, make sure the time and service level makes sense. Network errors, confirm every build, provider, lab imaging was in network. Here's an example. Marcus saw two lab processing fees for one blood draw. He flagged both. Billing removed a duplicate $180 charge. Now here's a pro tip. Use a highlighter, note each suspicious code or line before you call. It saves time later. Never assume a bill is perfect. Even small errors can add up fast. Have you ever called billing, explained an issue, and felt brushed off or overwhelmed by jargon? Here's how to stay calm, focused, and effective so your call actually gets results. How to call and dispute the charge. Call the provider's billing department first. Stay calm, specific, and factual. Your goal is accuracy, not an argument. Here's a sample script. Hi, I'm reviewing my recent bill and notice potential errors. Could you recheck the codes and charges for these lines and confirm they match what was actually done? Now, be ready with codes or line numbers for an itemized bill. If they confirm an error, ask them to correct it in the system and send you a revised bill in writing. If they insist it's correct but you still disagree, call your plan next. Ask for a claim review for processing with corrected codes. Plans can request documentation directly from the provider. Now, here's an example. Janet saw a $900 infusion service she never received. One call with codes in hand led billing to verify the mistake and issue a $0 corrected bill. Now, here's a pro tip. Take notes, name, department, date, time, and what was promised. Ask for a reference number if available. Have you ever been told we don't have a record of that conversation? That's why good notes are your safety net. Keep records of every call. Documentation wins disputes. For each contact, record name and department of the person you spoke with, date and time of the call or message, what was discussed, and any promised actions, reference number, if given. Keep EOBs, bills, and notes together, paper or digital. Now, here's an example. David tracked calls in a simple spreadsheet. Then, when a late fee appeared on a disputed charge, he sent billing his timeline. They waived the fee immediately. Now, here's a pro tip. Save portal messages or email screenshots or PDFs. Timestamp messages support formal disputes. Think this sounds too much? Here's how one patient turned a $3,000 bill into a $0 balance with just two calls. Alyssa received a $3,200 hospital bill after one night stay. Her EOB showed $1,500 owed, but something felt off. She requested an itemized bill and found a second night room fee. She stayed one night. Two IV kits. She got one. She called billing, referenced the codes, and asked for corrections. The revised bill dropped to $950. Her plan then processed the updated codes. Final balance, $0. Thorough beats aggressive. Two calls and a good notes can save a lot. Ever wonder which charges always deserve a second look? Here are the 5 red flags that pop up again and again on patient bills. Quick red flags that deserve a second look. Top 5 items to question. 1. Facility fees for short outpatient visits. Ask what the fee covered and if it's correct. 2. Observation status charges. Verify dates and times match your actual stay. 3. Level 4 and 5 visit codes. High complexity exams cost more. Ask if documentation support that level. 4. Multiple specialist fees the same day. Ensure they reflect distinct services. 5. Post discharge services. Anything dating after you went home. Now, here's an example. Ben saw a $400 observation charge from the monitoring after discharge. One call removed it. One red flag often reveals others. Each correction put money back in your pocket. When you think about your last bill, which of these steps would have saved you money or stress? Start with that next time. Pro tip roundup. 1. Wait for both the EOB and the provider bill. 2. Request an itemized bill with codes. 3. Scan for duplicates, upcoding, and any canceled services. 4. Call billing first. Be specific and polite. 5. Document every call and promise. 6. Compare the revised bill to your EOB before paying. Reviewing your bill isn't confrontation, it's smart financial self defense. Have you ever been stuck with a bill you couldn't afford, even after fixing errors? That's where the next step comes in, turning a big balance into something manageable. Reading and challenging a bill isn't about arguing, it's about accuracy. You're not fighting the system, you're keeping it honest. Now you know how to check every line, spot common mistakes, and communicate clearly with billing and your health plan to get fair results. Next, we'll go one step further: how to negotiate, set up payment plans, and access financial assistance programs when you still owe money after correction, so no bill becomes a crisis. I will see you in the next module.